All right, Linz, thank you very much. In the midst of this coronavirus pandemic, we know you have so many questions about this virus.
So we are joined live once again via Skype with Dr. Hawkinson with the University of Kansas Health System to get some of those questions answered. He's been joining us on a regular basis. Dr. Hawkinson, we appreciate it as always. We've heard a lot about people possibly spreading the virus before they know they're sick. Those asymptomatic folks we talk about a lot. How long should it take in most cases, are we finding it takes in most cases, for these symptoms to show up? And is it possible to have it and not know it? We've talked about that. How long might it be before they show up?
Yeah, that's a very good question. You know, certainly we are learning that 1 to maybe 2 days before symptoms you can spread disease. Typically, from a large study, only about 2% of patients will get symptoms of infection within 2.5 days. The majority of people are going to get symptoms by 5 to 7 days. And then probably by about 11 days, 98% of people who are going to have symptoms have had symptoms. So that's why they are using that protracted course of 14 days.
Doctor, is it possible for somebody to have COVID-19 and never have symptoms?
You know, initially out of the reports out of China, we really didn't think so. There were a very small fraction of cases, maybe 1% or less, who never had any symptoms. As we start getting further into this and looking at the populations here in the United States, there certainly could be a slightly larger fraction of patients that don't have symptoms. But for the majority, some people will get even just mild symptoms.
Okay, another thing we've been hearing a lot about is the drug hydroxychloroquine being used as a trial medicine for people who get sick from COVID-19. But right now we know there's also a nationwide shortage of that drug. Could this really work to treat COVID-19? And are we taking away the drug from people with other conditions who already use this drug who really need it?
Yeah, a couple questions. So can it work? We don't know. You know, we don't know the full spectrum of infection and what takes place when in the time of infection. You know, we were talking about symptoms. You know, what happens when symptoms first occur? Is it maybe reasonable to give it early in disease rather than late? Because by the time you get critical illness and hospitalization, is it too late? Has the virus really, for the most part, stopped replicating? And that becomes the damage to our body is from our own dysregulation of our immune system. So that could be. So we are still really looking at the efficacy of using hydroxychloroquine and when to use it. Also the safety. We know that some of the cardiology services and societies have put out statements saying it can be dangerous, it can prolong your heart rhythm and cause, you know, deleterious effects in your heart or heart attack, things of that nature. So we are still looking to see if hydroxychloroquine really can be efficacious at this point.
Doctor, we talk a lot about things spreading on countertops, that kind of thing, and what to clean those normal items around your home, especially where you do food. But what about personal items that we haven't talked about a lot? Things like your purses, glasses and contacts that you're putting on your face every day. We've heard things about whether or not men should shave their beards or wear neckties. What are some common personal items that maybe are possibly more susceptible to carrying this than others that we're not thinking about?
Yeah, that's a very good question too. You know, I think one of we've had a couple studies now showing how long it lives on surfaces. I think it's really telling. One of the studies out from University of Nebraska recently had some good information. One of the biggest points was that they were able to find evidence of the virus on about 85% of people's cell phones who had the infection. So anything like hard surfaces, like cell phones, like eyeglasses, things of that nature are certainly going to be probably a higher rate of having evidence of the virus. So it's important to clean those things off. And you can use just normal household cleaners. You can use soap and water. Those all work towards destroying the virus.
All those things that we carry or touch all day, every day, if we have them on our face, if we have them in our pockets, that kind of thing, especially those cell phones. Doctor, thank you as always for joining us. We really appreciate that information this morning.